There you go. Hi, Merrill.
Hi, Kate. How are
So
you?
I so appreciate you joining with me, and I really appreciate you just being willing to be a part of the grad school class for William Jessup University, the Crises, Trauma, and Community Mental Health. And we are specifically talking about EMDR and somatic therapy as well as brain spotting, but you and I are going to focus on EMDR. So how long have you been doing EMDR? You're a pro. I so appreciate you being here. And if you don't mind, and then what kind of population do you work with?
So, first of all, I was originally trained in 2004, and was pretty skeptical, to be honest, about EMDR. I had been introduced to it by my clinical supervisor. I was still unlicensed. No, I had been licensed about 5 years at that point. But I was skeptical, and but I started going actually to a regional group. And from there, I found out about certification, which I had never known anything about. Back in those days, you didn't get consultation or anything.
Right.
So I was really struggling on my own. And once I started the process of expanding my learning, I really became obsessed with it because I started seeing the incredible results for my clients. So as I became more secure with it, the results were phenomenal.
What were some of the results that you saw, and if you don't mind?
Well, in general, it just really changed people's lives in terms of how they were functioning and how they were reacting. I can give you specific examples of cases.
Yeah, that would be great. And you work with what ages do you work with?
So right now I work with just the general adult population because since COVID, I've been limiting my practice to Zoom, so remote, which works really, really well for EMDR.
Amazing.
So I completely gave up my office after a year of paying rent on an empty office.
Right.
I decided, I kind of like being at home in my own little office. So I'm going to continue to do it that way. And I'm able to see people from all over California. I have a lot of experience working with everyone from very young children up through geriatrics. I've worked with combat veterans, sexual abuse, trauma, both in children and adults. A lot of addictions work. I have a strong background in that. So I pretty much apply EMDR across the board. Relationship issues, attachment issues. It works really well for pretty much any presentation.
So you're saying that EMDR works with people who are struggling with addictions?
Oh, absolutely.
Okay. Can you tell me just a little bit more about that? And hang on just a second. I'm going to create less of a noise. I'm going to hit pause. Oh. Okay, so I was asking you about addiction work. What are the dangers of working with somebody what do we need to do with somebody that has addiction and doing EMDR?
Yeah, I think it's important to understand that an addiction, it's been conceptualized in the past by the medical community as a disease, but I see it more as a coping response. So it's a defense. And so we have to be aware that before we start processing the issues that a person is defending against by using, and it's not just using. An addiction, as we know, can be behavioral. It can be an eating disorder. It can be working too much. It's anything that somebody does in order to avoid their feelings or avoid the unpleasant situations that they're in. So it's an avoidance technique. If we focus on that and target the avoidance part of it, and teach the client to be able to give the client other tools in order to manage the feelings and deal with the issues that they're trying to avoid. Once we've done that, then we can get in and use EMDR protocols. We have several different EMDR-based protocols that will actually target the connections in the brain that keep in place the addiction. So just one more point. We know that for most people with an addiction, there is a positive, there's a lot of negative attached to it, but there's a benefit to it. So by using EMDR, we're able to help the client break that connection at the level of the brain between the positive payoff, the benefit, and the behavior.
Do you usually find with your clients when you're doing EMDR, your clients who are using a traditional addiction or a behavior, or maybe even they're addicted to controlling, or they're addicted to work or something like that, do you usually find that that's somehow trauma-based? Because what you're describing is we're healing the attachment part of the brain. We're like going into the attachment part. Is that?
Yes. So, it could be related to real trauma, to what we think of as what we call a big T trauma. So let's say a woman was raped when she was 8 years old. And when she was a teenager, she developed, she was accepted by a group of kids that were drinking. And so she started drinking and she became addicted to alcohol. So it's important to go back and to reprocess the memory of her being raped. But before we can do that, we first have to kind of fortify her emotionally so that she'll be able to tolerate the feelings that she's going to remember and reproduce when she is focusing on that experience, that traumatic experience. But then for a lot of other people, the addiction may be a way of coping with just the emptiness and loneliness because of what they didn't get from their parents.
Oh, so that's a really good point.
Yeah, so it could be small T traumas, things like, bullying and shame, or it could be the things that didn't happen for a child that needed to happen, such as availability of emotional availability of parents, the responsiveness of parents.
So you said that we need to fortify that. I know that as resourcing, but can you talk to the students a little bit about that?
Right. So built into the EMDR protocol, we have 8 phases. And the first phase is history taking and case conceptualization and developing a treatment plan collaboratively with the client. The second phase actually gets kind of interwoven with the first phase, and that is resourcing and strength building. So identifying and accessing the strengths and resources that the client has internally, and shining the light on that, because a lot of people really don't recognize, what they're so focused on their hurt that they don't recognize the positives in their life.
They don't recognize the strengths, or they don't, even the concept of post-traumatic stress growth might be new to them because they're so overwhelmed with that loneliness or that void that they had.
Yeah.
So what are some of the best outcomes of EMDR that you've experienced? And I know that that's like in your career, that's a lot.
It's a lot of cases. Yeah.
Yeah.
Because I do use EMDR pretty much exclusively in my practice.
Oh, excellent. And virtual EMDR, you use it virtually right now.
Right. Yeah, so I may bring in other modalities if I need to, kind of almost as interweaves with the EMDR. But most of the time it's just EMDR, straight EMDR. So let's see. There was a case, this is actually my favorite case,
Okay,
many
great.
years ago. I worked with a man who was, I would say, in his mid 60s. And he came in, and I could tell he wasn't well to begin with. He was very thin and fragile looking. He had this kind of gray complexion.
Right.
I thought actually he was a man suffering from cancer. That's kind of what he gave off. And he was very hunched over, in a lot of pain. He was on a lot of pain medication, and couldn't even drive. His wife had to drive him
Oh,
to
wow.
sessions.
Wow.
The thing that brought him into therapy was that he had a 2-year-old grandson, and his son was asking him to babysit his grandson once in a while. And the man was terrified of doing that. So we got into his history, and it turned out that he had been severely abused as a child, physically abused. He had 2 younger brothers. When he was 7, he had an infant brother, and he had, I think, a 3-year-old brother with cerebral palsy. And one day his parents left him and the 2 kids, and they went into his uncle's house for a bit. So he was focused on, the baby, I guess, was sleeping, and he was focused on entertaining the 3-year-old, the disabled 3-year-old. All of a sudden, he noticed that the baby had stopped breathing. And so he ran into the house, got the parents, and the baby was dead.
Oh,
So
dear.
they took my client, sent him into the house to stay with the uncle. They yelled and screamed at him that he killed his younger brother,
Oh, my goodness.
and they dashed off to the hospital with the 3-year-old and the infant. So the connection, excuse me, seemed very clear,
Right.
that between what was going on in the present, which was triggering this intense fear, having to take care of his grandson, going all the way back to being 7 years old, when he was taking care of, as a 7-year-old, a baby and a disabled 3-year-old.
Right.
And the baby died under his care.
Wow.
And of course, he carried this belief that it's my fault,
Right.
all the way, all these years.
Yeah. So in doing the EMDR, what did you find? What happened to his ashen tone, or what happened to him physically, mentally, emotionally?
Right. Thanks for asking that. That's the interesting part, because so you may be familiar with the book by Bessel van der Kolk, The Body Keeps the Score.
Yeah, it's actually a required textbook for the class.
Great. Okay. So I saw this demonstrated. It was like watching magic, because as in our beginning sessions, we were just focused on doing the things that we do for resourcing, created guided imagery exercises, focused breathing, all the calming and mindfulness that we use. And as we were going through this, gradually, I saw this client come in with more color in his face. He was straightening up. He started driving himself. We hadn't even gotten into the EMDR processing yet. And one day he came in, and he was almost bouncing like Tigger. And he said his wife had noticed a difference, and his acupuncturist told him, "I don't think you need to be on medication anymore." So
Wow.
he was able to back off of his, under doctor's orders, he was able to
Uh-huh.
back off of his pain meds.
Uh-huh.
And by the time we finished all of the EMDR processing, including reprocessing and turning off the present triggers, desensitizing those triggers,
Right.
and creating a future template or a vision for how he would prefer to be reacting and functioning in the future. By
Mhm.
the time we finished that, it's like he had lost at least 10 or 15 years of age. He was healthy and vibrant. He was babysitting for his grandson and loving it.
Oh, that's great.
It
Oh,
was,
that's
it was
amazing.
beautiful. And he did the whole thing in 3 months.
Wow. Wow. See, that's what is amazing to me is that typically if we were doing talk therapy, I mean, that could last years to get
Right.
to that and to create that kind of change that neurologically and in the attachment, the depths of who he is, you using EMDR, we're allowed to
Yeah.
work
If
with and
ever,
heal.
if ever. In fact, I have
Right, if ever. That's a
I
good
have a
point.
fairly new client now who has been in talk therapy for 9 years.
Right. Mhm.
And he is still severely depressed.
Yeah. So what do you think? These are grad school students, that we're talking to. So what do you think
Oh, you
is,
just froze up.
oh, am I connected now?
Good. You're good.
Okay.
Yeah.
Okay. So with grad school students, who are young in their therapeutic process and even understanding the type of therapy, the modality that they want to use, what would be some of your reservations, or what would you want them to know about before they started using? I call it the power tool, EMDR. I consider it a power tool, but I don't know, like maybe somebody who's really young as a therapist can use a power tool. What's your thoughts on that?
Well, I think anybody who's capable of going to grad school is capable of learning and understanding EMDR, first of all.
Okay, there you go.
Second of all, once I became trained in EMDR, that's when I really started learning about trauma in the respect of what it does to the brain, how it
Mhm.
miswires the brain, so to speak.
Right,
And,
right,
and that EMDR will correct that wiring. It's like rewiring your computer so that it functions better.
right. So, yeah,
So I would say for students to learn about the effects of trauma, have somewhat of a neurological focus in their studies,
mhm,
just enough as background. And
yeah,
because of doing that, they understand defenses, including dissociation and addiction, and how they function as defenses and why defenses are so important. We all have defenses,
right, yeah,
but how they can get in the way, because it's those defenses. If as a therapist, if you're not aware of how a client is defending against these emotionally held memories, if you don't learn to recognize what's going on, then you're going to miss it, and nothing will work, no matter what modality you're using.
what is I think I agree with you completely. What is one of the more difficult defenses that you've experienced that a client has used, maybe in relationship with you or as part of the therapy process?
I'd say there are two. One is having an avoidant type of attachment.
Right,
So, in order to heal, a client needs to be able to form a healing and trusting attachment with a therapist. But if a client is not capable of doing that because of that's what resulted from their early experiences,
mhm, mhm.
then it makes your work a lot harder at the beginning, because no therapy is going to work without a really strong therapeutic relationship.
So
So
in that client that has that, maybe not avoidant personality disorder, but maybe, if they have that avoidant attachment, how do you target that when they're not even, they're actually depersonalized to even themselves, let alone to other people?
Right. Well, you used the word depersonalized, which
Right,
is a form of dissociation, which
right.
is the second defense that I was going to mention.
Oh,
And
okay.
sometimes they come, they are kind of interwoven.
Mhm,
Um,
mhm.
so learning when a client is not able to connect with their feelings and they are dissociating from them and kind of pushing you away because of that, and also pushing away from themselves, depersonalizing.
Right.
So learning that really, I think it takes experience and it takes a lot of additional training and reading.
And
So it's not
a lot of
something.
patience,
Yes,
right? A lot
a
of
lot of
patience.
patience. You're going to go more slowly. Sometimes with clients that are really heavily defended, you could spend 6 months to a year just in the first couple of phases of EMDR.
Oh,
The history taking and the resource developing and the relationship building.
right. So just because a client comes to you and says, I want EMDR, I've had a history of trauma, that doesn't mean that they're going to jump right into the processing portion of EMDR. That's what I'm hearing you say,
Yeah,
that it might take some time before we do the processing.
right.
So there has to be a level of trust between the therapist and the client in order to do the EMDR work.
Yes, in order to do any therapy work, whether it
Right.
be EMDR or any other kind of work.
Mm.
Um, and occasionally I've had clients who will come in and they say, I want to do EMDR, so I want to do it with you. And I get to know them and I see that they are so defended that they're not going to be able to access these trauma memories. Um, and so they need a lot more preparation, or even going through the normal preparation stages. They're pushing me. They're like, I thought, I'm paying you. I thought we were going to do
Right.
EMDR. I
Mhm.
explained, well, we are doing EMDR. We're in the first couple of phases, but
Right.
we have to take our time until you're ready. And they get angry with me. And then I've been fired once or twice by people like that because I'm
Right.
not going fast enough.
Right. That dissociative, and if they're not able to emotionally regulate and still they're dissociative, that's really tricky work, um, to work with. It might take some years and it might take some consultation, especially for a young therapist, I would think.
Right. And fortunately, we do have a lot of consultants that can help. We kind of put our heads
Right.
together and
Uh-huh.
try to figure out the best approach. And there are a lot of advanced trainings. Once you've had the basic training in EMDR, there are many, many, many ongoing trainings that you can take for one day or a weekend or whatever in issues like addiction work,
Mhm.
attachment focused work, um,
Couples work?
association.
Yeah. Uh-huh. Um, do you do RTEP and GTEP? So could you talk to the class a little bit about that and that work and how you became familiar with that and how you've used it possibly?
Sure. So RTEP and GTEP, along with a couple of other protocols, there's one called IGTP, and these are all initials. They're
Right.
acronyms.
Yeah.
They are specifically for recent traumas. So a trauma that has happened within the first 3 months, when the memory has not consolidated into something that's organized.
Mhm.
So the memory is still fragmented, with a number of different traumatic points or periods in it, pieces
Mhm.
of it. So it's important that we process or reprocess each of those different trauma pieces and then put them all together to integrate them. And that's what RTEP, GTEP is just a group version of that.
Right.
IGP is another group version of that. Stands for EMDR, Integrated Group Treatment Protocol. GTEP is group.
Treatment intervention protocol. I'm not.
No, I'm blanking. RTEP is recent trauma EMDR protocol. So GTEP must be group
Group
trauma, something like that.
trauma. Yeah.
Yeah.
Mhm. I'll look that up and let
Yeah.
them know what it is. Yeah.
And then in basic training, we teach the recent event protocol, which I actually use that a lot.
The recent event
The
protocol.
recent event protocol, yeah. And I mean, this is the protocol that Francine Shapiro developed.
Right.
And you're focusing on that recent event, and you're just having the client go through the story and identify the most disturbing parts. And then you take each one of those parts and apply the EMDR protocol
Mhm.
or assessment phase, which is phase 3,
Right.
to activate the memory. And you go through a piece, you go all the way through the first piece, and then you go to the next piece, and then the next piece. And then when you've neutralized all of those, then you take the whole story again.
Mm.
And
Mhm.
by that time, it's integrated.
Like, for instance, if someone recently was in a serious car accident, you would break it down piece by piece
Yes.
and then get it to zero disturbance, zero disturbance, zero disturbance, and then run the whole story. Is that what
Run the
you're
whole
saying?
story, yes.
Mhm.
And then you finish up with have the client give you a positive belief about themselves. So
Right.
they run the whole story with that positive belief in mind. And
Mhm.
while the client is reprocessing, of course, this goes along with the EMDR, is that they are doing bilateral stimulation,
Right.
moving the eyes back and forth.
Yeah.
And then at the very end, you do a body scan. So they're checking their body as they think of the memory and the positive belief, looking for any leftover somatic disturbance.
Yeah. So EMDR helps the cognition. It helps the somaticizing, any stress in the body, and helps with self-esteem, helps reduce that trauma. That's what you're saying.
Yes.
Any of the effects of trauma.
Right. EMDR is a fully integrated psychotherapy
Right.
where you're using elements of somatic processing and cognitive therapy, behavioral therapy, psychodynamic, narrative therapy. All of that is involved at a neurobiological level.
Yeah.
It's all integrated into one psychotherapy.
Yeah. I think it's even though it's trauma therapy and it's very focused trauma therapy, it's also has elements of positive psychology, because you're looking at the past, looking at your strengths in the past, the present, and then looking at the future, and having that positive cognition, like that gentleman that you worked with that was babysitting his grandson, being able to be with his grandson and be around those triggers and not have them have a negative affect, but that positive affect. That sounds really.
Yeah, exactly. Positive affect and positive belief.
Yeah. Yeah, positive affect, but also a true affect and a true belief, right?
Yes.
So it's not just I am beautiful, it's I am worthwhile.
Yeah.
So,
Yeah. And that's, we start out the reprocessing session we ask the client for a negative belief,
Right.
which is something that is at their core, like I'm not good enough, or
Mhm.
I'm bad, something that they've believed their whole entire life, that's at the root of pretty much everything that's happened to them. And where does that come from? It comes from a very early place. When we're
Mhm.
young children, we tend to internalize and blame things that are really completely not under our control. But
Right.
and there are some existential reasons why we do this, as well as the level of brain development that a young child has. The brain is only a fraction developed at that stage, and they haven't had a lot of different experiences to give them an awareness of what is reality. And they can't, if you're being beaten by your father,
Right.
you can't believe that dad is bad, because if you have a bad dad, then what does it say about your survival? You're completely
Right.
dependent on
Mhm.
this person.
Mhm.
So you have to believe, for your own sense of security, that it can't be dad, so it must be me.
Right.
And
Right.
so I have to try harder and I have to be a good boy, but gosh, I keep getting beaten. So I must really be bad.
Right. So then they have this pervasive shame. So once that is reprocessed and the truth is integrated into their lives, then relationships change, I would imagine.
Yes. That
Do you help clients with that relationship process as they're maybe in relationships and now thinking that they're worthwhile, or that they do deserve to have a voice, or they do deserve to be protected and things like that?
Right. In fact, so many people come in for therapy because their relationships are in trouble, and they recognize that they keep having the same pattern with people. Their relationships just aren't working out for
Right.
one reason or another. And when you take them back to where this all started, that what we do is we repeat the same patterns that we've learned.
Right.
And
We just can't help that.
we can't
Right.
help it because that's what's wired into our brains,
Right.
right?
Yeah.
That's the only way we know.
Yeah. So I told the class that a lot of times people stay stuck in bad relationships because why move from hell? Because we know all the street signs.
Yeah,
We're familiar. It feels really comfortable and it feels at home.
right.
So
But it's
this is actually freeing them up from negative beliefs and improving their relationships. And then it just has a ripple effect. Maybe the whole world needs to do EMDR, especially after the last 2 years that we've had.
oh, yes, absolutely. I mean, that
Yeah.
was Francine Shapiro's vision, is healing the world one person at a time.
Oh, wow.
Yeah.
Yeah. It's beautiful. Did you get training from Francine Shapiro then in your
Not from her personally,
okay.
but I was trained by um, actually her ex-husband,
Okay.
which I didn't know until recently.
Oh, that's interesting. That's an
Yeah.
interesting aspect of that.
Yeah. So he was there at the beginning with her.
Uh-huh. Yeah. Well, and then they got healthy and then they moved apart. Yeah.
I
That's my
know.
story. That's what I'm
Yeah,
gonna say.
I don't know. I
I
don't know
don't
what
know.
the circumstances were.
Yeah. Well, I'll edit that out.
Kind of don't go there.
Yeah, I'll edit that out.
Yeah.
Okay. So is there anything else that you would want the grad school students to know about EMDR and about this process?
Mainly just the summary that whatever we are experiencing in the present, which is troublesome, which brings out symptoms in us, which causes our symptoms, is rooted in past events. And that is the theory that's underlying EMDR work. So
Right.
when we can identify and target those earliest memories when these patterns developed, because originally the patterns of behavior, they were usually to cope with bad situations that the young person didn't know how to deal with, but those coping skills no longer serve in adulthood.
Mm.
And
Yeah.
then that can cause depression, anxiety, all,
Mhm.
but those are symptoms. Those symptoms are attached to present day issues or problems. Those present day issues or problems are rooted in the past.
Right.
So we have to go back to the past. Francine Shapiro said the past is present.
Right.
And I think it was William Saroyan said, the past is present. In fact, it isn't even past.
Yeah, because we just keep living it out.
We keep living it out. Yeah.
Well, I really appreciate you taking this time and letting and encouraging them and inspiring myself and the grad school students on what EMDR is about. And
I
so,
hope they're inspired, and once they get their degrees and they start working towards licensure, they can get trained in EMDR. You don't have to be licensed. And if you're working for a nonprofit, you can get trained through the Humanitarian Assistance Program and receive your training at a discount. And usually what happens is the nonprofit will pay,
okay,
depending on which nonprofit you're working for,
right,
but
right.
it is discounted.
So, and you're a trainer, is that right
Yes.
also?
Yeah, in fact, I have a training coming up the first weekend of December, and we have a brand new manual. So I have to update all my material.
Okay, so if any of the students want to find you, it's Merrill Powers Therapy, right?
No, it's Merrill at
Merrill?
powerstherapist.com.
Okay.
And my website is powerstherapist.com.
Oh, I like that. Powerstherapist.com. Okay.
Yeah, thank you. Thank you
So,
for inviting me. And I'm so happy that you're bringing more into our field, because actually, as therapists, we are all overwhelmed with too many clients.
right, right. Well, hopefully you'll see some of these grad school students in some of the trainings. That would be exciting.
That'd be wonderful. And
Yeah.
if any of you do take a training with me and you got your start with Kate, then please let me know.
Okay. Okay. Thank you, Meryl.
You're
So I'm
welcome.
going to hit stop record.